cells and prevent the lady from becoming a mother later on if she wishes to. For example, in cancers like breast cancer, ovarian cancer, uterine cancer, cervical cancer, and also gastrointestinal cancer, various forms of chemotherapy, radiotherapy, and surgery have to be offered to these young ladies. In certain forms of cancer, we need to remove the uterus and ovaries. However, in certain borderline cancers, we may just remove part of the ovarian tissue and preserve the ovaries so that she can become pregnant later on. This is of course possible in only a small subset of patients suffering from borderline ovarian cancer. We can also preserve the eggs of these patients before submitting them to chemotherapy by doing oocyte cryopreservation. For these, we have to give them gonadotropin injections for about 10 days prior to egg pickup. The advances in this field have come up to such a stage that gonadotropin stimulation can start from any day in any time of the menstrual cycle. This saves the patient for waiting for 15 to 20 days to wait for the next menstrual cycle, which used to happen even a couple of years ago. Once the eggs are picked up, they are then preserved in liquid nitrogen. When the lady has completed her chemotherapy and is ready to come back for parenthood, these eggs are then thawed and then fertilized with the partner's sperm through intracytoplasmic sperm injection. The embryos are formed and then transplanted into the patient's uterus. That is, an IVF procedure is performed for the woman to get pregnant later on whenever she wishes to. We can also remove the ovarian tissue and place it in liquid nitrogen, and later on, after the treatment is complete, transpose it back to the pelvic foramen and wait for normal menstrual cycles and normal fertility to resume. We thus see that there is a huge armamentarium that we can offer to these young ladies to fulfill their dreams of parenthood later on. Cancer treatment has advanced substantially, and these young ladies are living a long, happy, healthy life. Let us contribute in making their life more fulfilling by becoming parents.